Hello, I'm Dr. John Petrick, President and CEO of the Las Vegas Pain Relief Center, and we're here today to discuss the functional movement screen. The functional movement screen is a way for us to determine and establish a treatment plan or prescription for our patients. It is 7 movements based upon an ability to a patient to move, and we're going to be looking at those particular 7 areas, and we're going to be giving them a screen score. Now that score is scored from 0 to 3. If you have pain in the movement, you get a 0. If we add a correction and you still can't do it, you get a 1. And if we add a correction and you can do it fine, you get a 2. And then if you do the movement perfectly, the patient would get a 3. The first movement pattern we're going to look at today is the squat. It's a normal standard movement pattern that everyone does throughout their normal day. But we're going to look at it and determine what her score would be. So one of the first things we're looking at is we're looking at Jen's movement patterns. Does her chest fall in front of her knees? Does her knees cave? Does her heels rise up? But we're just going to be taking a look at this first initial movement pattern. And go ahead, Jen, let's see that initial squat. So you can see what's happening is here is that if you look from the side view, she's not quite dropping down as far as we'd like her to. At the same time, she's leaning way forward. The bar is in front of her knees, and her knees are starting to narrow, if you can see in the camera. So we're going to have her come back up. What we're going to do now is provide her with an assistance or a correction to see if that does not help and improve the squat. You'll see a difference in the squat is if she can drop lower, her knees don't cave, and that bar still stays behind her knees. So go ahead and squat down, Jen, for us. And if you notice, look at the depth in which she has in her squat here. And Jen, go all the way down. And you can actually see she's not losing balance. She's standing up nice and tall. We're going to do that squat one more time. The bar stays over behind her knees. The bar does not go out front. Her knees aren't caving, and she has nice depth. Just for effect, go ahead and stand up. Bruno, go ahead and remove that. Perfect, thank you. And squat down again for me, Jen, just so that the audience can see the difference in the squat. And again, it almost doesn't feel normal now.
Right, no.
It totally feels different now. So as you can see, this is one of those things that we're going to grade her with the 2. That means that when we added a correction, she actually completed it and the squat turned out to look perfect. So with that one, that was a squat. We're going to score her with a 2 in her squat. Okay, the second movement that we're going to be discussing today and demonstrating is something called the hurdle step. Now, this is extremely important because we're picking up some variations in what's happening with the hip. As she's going through the movement patterns, we're noticing, does she have to rotate the hip out in order to step over? Does she have to rotate the hip in order to step over? Or does she have to turn her body to the side in order to step over? What that tells us is that she's having to engage certain structures in a simple motion like a hurdle step in order for her to complete it. One of the first things we do is we want to measure from the floor to her, ultimately to her, to right underneath the knee. And she's got a measurement right now of about 16. And so that's going to eventually play a role as we set this up at 16. So you want the level from the floor to the peg to be about 16 inches high. So that's kind of that right in the middle of that below the knee. We're going to place the dowel right there behind her neck and have her kind of comfortably keep it there. She doesn't have to necessarily, it's not a squat position. She's going to bring her feet all the way up to the board. The feet are going to be together. And she's going to be looking straight ahead. She'll be lifting one leg over, stepping down, touching it to the floor, and then bringing it back. And what we're noticing is what's happening to her body during that motion. So go ahead, Jen, step over, and then step back. Good. So we're going to do that one more time, and I'm going to have you do it at normal speed, but I want you to see what happens to her right leg as she's stepping over the bar, what's happening to the foot. And then step down, and then step back. So So subtly what's happening here with Jen is she's actually having to turn the foot in. So you can see she's turning the foot in order to step down. So when she does this, she has to do that particular movement, which is not a perfect, necessary or perfect score or movement pattern. Let's demonstrate on the left side, Jen, to see if you do that same pattern. And bring it back. And step down. Good. So the left side looked a little bit different than the right. On the right side, she had a little bit more hip rotator action going on there. Let's demonstrate that right side one more time just to see if we can do any correct. And then you just got to see her rotate the foot in just like this in order for her to complete the maneuver. So with this, we're going to give her a score of a 2. She couldn't do it perfectly, stepping down with the heel and stepping back over, so we're going to give her a 2 on that particular score. Now, real quick point of order, what happens, if you notice the left side ultimately was almost pretty much perfect, but you're going to give her the lowest score that, of the 2. So what will happen is that if she had a 3 on the left side and a 2 on the right side, her overall score is going to be a 2. Okay, the third movement of the 7 movement pattern for the functional movement screen is going to be the in-line lunge. Now again, this is looking for balance and coordination. It's also looking for internal and external rotation of the hip, making sure that again, as she's staying in balance, in line, and she's not having a break in movement. So we're going to set her up, and again, we measured with the same measurement that we did from the bottom of that ass, that right there, bottom of the knee, to the floor was 16 inches. We're going to use that same 16 inches on the board. So she'll be stepping back. It doesn't matter which foot, Jen. Put one foot behind the 0 as close to it as you can on the board. Perfect. And the other one we're going to have you step out with to the 16 mark all the way out there with the heel. So back that up. Perfect. Just about perfect. Excellent. So she has to take the dowel. She's going to be taking the opposite end in front, and she's going to be holding this behind her head, behind the neck, and this one ultimately goes into the small of the back. Perfect. Now we have her balanced. We're going to have her rest the back on her heel, rest back on that heel, this heel. So put your heel down, Jen. Perfect. Excellent. Now, one of the things we're going to be looking for is she wobbling? She seems to be perfectly balanced, as you can tell. She's touching all 3 places, the back of her head, her mid-back, which is a little bit concavity here, so she's got a little bit of a space for her mid-back, and she's touching at her, on her sacrum. So she's actually, of the 3 starting out already, she's got a slight deficit that says she's not touching the mid-back. I'm going to force it back, ultimately, so she can feel the difference of what it feels like to have it touched and what she feels like to be normal. So just now relax into your normal. So again, she's pulling away. Now she's touching that mid-back area, and you're really good. Now she's going to bend her back knee and bring it to near the heel of the foot in front. And then back up. Good. And she noticed she didn't lose balance. She stayed in perfect control, and we weren't worrying about her falling at that time. So because she is now touching all 3 points of contact, she completed the exercise. We now give her a 3 for that particular movement. We're going to switch sides, and we're going to be bringing her onto the other side. You'll be switching your leg position and your arm position.
Oh, wait, this one, right?
Yep. So you got it behind the neck. It is the arm that's opposite the leg that's forward. It's in the small of the back. It's touching her mid-back and all 3 points of contact. She'll be bending the back leg behind the front leg, and then she'll be coming up. She had no break in any of the 3 points. She did not lose balance. She squatted and came back. She's got a 3 on that side. Perfect. Excellent. All right, the 4th maneuver we're going to be measuring for the functional movement screen is shoulder mobility. And this is really, really important because this will show up in a lot of other areas. Again, please keep in mind that the latissimus dorsi muscle, even though it's a low back structure, it connects to the humeral head. So it does control some arm motion, even though it starts clear down here in the lumbar spine. So we're going to be measuring her hand, and she has a measurement of just about 6.5. So we're going to be turning her around so that you can see it on camera. She'll be bringing one arm out to the side, the other arm out to the side, making a fist, a light fist, and she's going to be bringing one behind her and one over top of her head, and we're going to be measuring the distance between the 2. She should actually make a fist, please, both fists, and she should be, if she has normal ranges of motion, she should be right in that 6.5. So she's slightly off. Let's switch sides, Jen, and do the other side, please. And again, we're measuring here, and again, we're looking for an asymmetry. So on this one, you can actually see, I don't know how well the camera can show, but this one, she's actually almost at 8.5. Do the other side one more time, Jen. And this one, she's actually almost 9, almost 9.5. So we know that we have an asymmetry. So bring your shoulders down. So what that tells us on the one, either she's got an internal rotation limitation on the right side, or she has an external rotation limitation on the left side, or vice versa, or both. But it's really important to be able to determine what her asymmetries were. With that, because she came close but not completely within that 6.5 measurement that we started with, she's going to receive a 2 for that because of the amount, how close she was, not a 3 where it was perfect. With that, there's not really an adaptation or a correction you can make there, so really you're just going to have to give her the raw score. You measure this one as well, both sides, and you give her the lowest score of the 2. So on that one, she had 2 2s, so ultimately she'd have a 2. The fifth maneuver we're going to be demonstrating is something called the active straight leg raise. Now this is important because this is going to tell us a little bit about what's going on with the hip, a little bit about the hamstring, and as well as sometimes you can differentiate between a disc injury and other peripheral nerve entrapments. So one of the first things we're going to do is watch both feet. We want to make sure this foot does not rotate in and out as she goes. As soon as it moves, that's when we stop our measurement. Now, what we're looking for with this one is that does she reach the bar? How close to the bar does she get? And does she go beyond the bar? If she goes beyond the bar or to the bar, that's a 3. If she can't get to the bar within an approximation of a few inches, then that's going to be a 2. And if she can't even get it up, or she has to move one of the feet at that point, then that'll ultimately be a 1. So we're going to measure. We're going to ask her to make sure her palms are up. She's going to be bringing this up. We're going to be watching this foot if she's moving this one, and she's bringing it all the way up. And as you can see, nothing moved down there, and the foot is above or actually to the actual dowel or the stick. So therefore, she gets a 3 on this side. I'm going to move the stick in front so you can actually get a better view of this right here. But go ahead and bring that one up, Jen. Nothing moved down here. Not quite as much on this side, but she's still within inside that 3 range. So we're going to drop it down, Jen, one more time, and then bring it all the way up as high as you can. And you can see ultimately she's in a perfect 3 position. So excellent. You can bring that down. So we're going to give her a raw score or total score of 3 for our active straight leg raise. The 6th move of the 7 moves of the functional movement screen is the trunk stability push-up. Now, the trunk stability push-up is a full body movement. When we're looking for gaps, we'll do the hips sag, do the hips rainbow. We're ultimately looking at can she complete the movement on her toes, on her hands without any particular type of sway or sag. The hands actually go down. She'll be face down onto the mat. The hands go to the side of the ear to the eyebrow. They come inside. They're not any wider than the shoulder, but they're also not narrow, so they're just at normal shoulder width position. She's up on her toes, and she pushes up into this position. For most women, or it depends upon women or men, for women you actually start lower at shoulder weight, and then you can try the 3 at the top. We like to do it both versus male or female. It really doesn't matter. We like to meet people where they are. So Jen, we'll have you to demonstrate that. You're actually, we're going to be bringing this up to right about your ear level or your shoulder level. You're beginning up on your toes. And again, we're looking for one solid piece. So if she sags, obviously that's not a perfect trunk stability push-up. Or if she rainbows, means she comes up in an arch or a hump, that's also not good. So go ahead and Jen, push up for us. And as you can see, stay there, Jen. Nice, beautiful, all one piece. It came up. Jen, I'm going to have you sag for me, stay up. But sag your hips. Keep your shoulders up. Bring these up. Straighten your arms, but drop your hips. Good. That's sagging. If you can see, she's sagging there in that particular position. And then push all the way up, Jen, for me. Get up on your toes for me. And that would be as if she rainbows. So this would not be a successful trunk stability push-up, and neither would be the sag. Okay. The final maneuver of the functional movement screen that we're going to check today and measure is going to be something called the Rotary Stability. Again, this is a balance and coordination move. It's also a coordination of all the tissues on one side or possibly intermittently between each side, left or right. So what we're going to do is to demonstrate, we're going to start here. You're going to be straddling the board for me, Jen. You're going to get down to on all fours for me, please. Excellent. Hands touching the board. Touching it, not on it. Yeah, touching it. Perfect. What we're going to be having her do now for the trunk stability push-up is bring this leg back. she's going to be bringing this arm out. Now, this is only at level 2. Level 3 we'll describe and discuss in a minute, but we always start with level 2 first, and you'll see why in a minute. So she's going to be bringing her elbow and her knee together, touching, and then back out straight as an arrow, pushing, and that would be the demonstration of a perfect, ultimately a perfect 2. Now, to demonstrate a perfect 3, drop down for me, Jen, just same position. She's going to be bringing up the right side and the right arm at the same time.
Okay.
So go ahead and you can just try to attempt that and you'll see. So what this is measuring her balance and coordination. She's going to be trying to bring the elbow and the knee together. This is probably by far one of the hardest of the maneuvers that we utilize is this. So let's try the opposite side. Let's go your left arm and right leg. Actually, let's go your left arm and right leg. Good. Good. And touch. And go. Perfect. And back down now. So she did that. She didn't lose her balance. The knees, they touched. She actually completed that. Her lowest score would have been a 2. We'll have her try it on the other side. We would. We don't need to. At this particular point, we know her score ultimately is going to be a 2. Okay. All right. Next two, the last two. These are called ultimately. These are apprehension tests. We're going to see if she has any apprehension to these tests. You're going to be into a cobra's position on all straight down on your stomach, chest back. Perfect. Yep, this is a cobra position. What we're doing here is checking to see if she has any pain. Does she have any pain in the spine? Does she have any pain in the neck? Does she have pain in the shoulder? This is a general movement pattern. We're looking for pain anywhere here. If she has pain, she typically flunks the test or it's considered a fail. She's going to come back into what's known as child's position. And we're asking that same apprehension question. Do you have pain anywhere in your body, regardless of where it is? If she has pain, it's considered a fail. Both of these, she obviously passed without pain, and she had full function. So that today is the functional movement screen at the Las Vegas Pain Relief Center. Thanks for tuning in. Come get your score and check us out.